a representative from almost every CHNA. So it'll be a chance for you to really get a perspective on what's going on across the state. We have been working in an Inter-CHNA capacity for quite a few years, and so now we know what each other are doing in our regions. And out of that actually came this need or request from CHNAs to even know more. So they were pretty happy about what they were finding out from each other in their own regions. They said, oh, I wonder what we're doing, you know, what are they doing out in Central Mass or in, you know, the Northeast or the Southeast.
However, I've done speed dating for a really long time in a way to exchange information very quickly and very concisely and get an opportunity to talk to a lot of people. So it takes a little help in getting everything set up. So we're about 40 people in the room. Does anybody, is that about right? About 40 people in the room. So what we're going to do is we're going to use these two rows. Okay, so why don't you show here? You're going to introduce yourself. You're going to identify the area where your CHNA is, say the name of your CHNA, and we're going to give you about 15 minutes, about 5 minutes to talk about each question. Then I'm going to ask everybody in this row. You're going to move around. The last person will come to this seat. You will all move over one, and everybody in this row will do the same, and then you will have a new partner. Tell me about the makeup of your CHNA, who sits at the table, who's interesting that's at the table, what interesting person or what interesting organizations have you engaged, and who's missing from the table. Begin by introducing yourself and talk amongst yourself.
My name is Eileen, and I work I'm part of the CHNA Marlboro, which is a greater series. We have a lot of interesting organizations on the table.
We also do a retreat this summertime.
People who are in the shifting line, shift one seat. 10-minute debrief of some of the things that you heard, some things that you might want to share with the rest of the group. And I do encourage you during lunch and during the break time that you seek out people and continue these discussions. So, last question. Welcome to Wendy's utopian world. It's where I live, on a little cottage on the banks of denial. You have all the money in the world. You have all the resources in the world. You have no problem bringing people to the table. Name up to 3 things that your community could do to improve the health in your area.
Exciting way to start.
Wow. So we're going to take about 5 or 7 minutes just to sort of inform the group some of the interesting things you heard or unique things you heard. I could fill the 7 minutes, but it's much more interesting if you participate. So who wants to start us off? Tell me something you heard, something that was interesting. Tell us your name again.
Kevin Rudden, CHNA 6, Milford.
Okay, Kevin, go ahead.
A couple of the CHNAs I talked to shared a similar thing where you have one larger community surrounded by a lot of smaller ones, and the smaller ones think they have different needs than the larger one. It's a question of how you get them engaged or continually engaged and make them feel their needs are being met as well as the larger community.
Excellent. Not only is that an excellent issue, but the best part about what you said is there are a number of CHNAs that have the same issue.
Exactly.
That's what we have to connect about. Somebody else? What else is going on?
For those who may not know me, my name is Steve Ridini. I'm from Health Resources in Action, and I'll be facilitating the rest of the day. The conversations this morning were really interesting, and we want to continue these conversations and to really engage you in some interactive exercises. Before we go there, though, I wanted to give you a few of my own observations of what I've heard from the conversation this morning. This won't be an entire list, but a few things that I felt like stood out. One is I think it's important to recognize the loss of what you may be experiencing, both in terms of either staff from regional centers that aren't there, And I can say that as one of a regional center person who used to provide a lot of training in TA to CHNAs, or other types of loss. I also think, going back to the woman, I think, from Springfield, and what I heard from a few others, it's important for you to all articulate what it is you're passionate about, your vision for this work, the guiding principles, as well as that you're change agents, and you're a voice for change in this state, in your own communities, but in this state, and to continue to articulate that in as many settings with as many people as possible. And so this next exercise is a little bit about visioning. As we've probably all realized in our work, you need a vision, correct? You keep doing this. Actually, I would ask you to do this individually first, because I also find this is a really interesting exercise when I work with coalitions, is when I ask people to do visions individually to see how closely they're aligned with other members of their group. So the question is this, moving forward, what's your CHNA's vision for building healthy communities and improving population health? There's no right or wrong answer here. So take a minute or two to answer this, and I'm going to ask you to find other members from your CHNA and have a conversation, which is really good. What I'd ask you to do is stand up in your area with the other members of your CHNA, and I'd like you to just share some of your thoughts. And if you could keep it to like about a minute or two. Who wants to start? Okay.
Came up with the creation of a hub that provides space for shared learning, collaboration, networking, cross-issue interaction that ties together efforts to improve overall health. That's the World Health Organization definition of health, not just our physical health, for the community and all of its members. Cool.
Both physical learning space.
Yeah,
I like it.
good wisdom.
Yeah, I'm going to take, as you're done, I'm going to take them and put them up. So thank you. Another group. I'm going to leave these up there. We'll take that. So you can look at them at lunchtime. Thank you. Next group.
Sure. Hi, I'm Frank Conley with CHNA 17, Cambridge, Somerville, Watertown, Belmont, Arlington, and Waltham, and the Regional Center for Healthier Communities out of the Mount Auburn Hospital. So we don't have a statement per se, and we did go through a long, arduous assessment and process to get us where we are today. So currently today we're working on 3 areas, food and activity issues, mental health, youth-related health issues, and safety promotion / crime. So it's really 3 areas that we're really helping to sustain right now as we speak.
Patty Jean Horton from CHNA 23, which we take care of Rockland, Hanover, Hanson, all the way down to Plymouth. So we have 12 communities that we serve. And right now we do not have a vision statement, but we are looking at our health literacy assessment that's being done, and we'll be creating our vision statement from that.
We're at CHNA 11, which is the City of Lawrence Mayor's Health Task Force. It's weird because we started as the City of Lawrence Mayor's Health Task Force, and in 2010, DPH asked us to sort of absorb CHNA 11. So we talked about a lot, but it seemed to me that the core of everything we talked about was really related to engagement and participation. We have a lot of people at the table, different levels of commitment. So I think that that true participation highlighted here and the engagement from all sectors of the community is needed. When we talk about community, we're talking about residents and engaging them in the work that we are doing in some shape or form, and to educate them around public health and you know, the benefits. Businesses, we have a lot of businesses, and now we have this group that's meeting, that's mimicking the Lowell plan. So I'm at the table trying to get them to sort of look at what we're doing over here. Don't start nothing new, because there's a lot happening already.
Hi, so in Boston, we've been going through a large planning process. So we created a vision for what we saw as a healthy Boston, and then have come up with 5 particular issues that we're going to focus on, which are health equity, better connection between healthcare and prevention, community resilience in the face of trauma, focus on social determinants of health, particularly education and employment, and involving newcomers and immigrants in community decision-making processes.
So what's going on in Springfield? What's your vision?
Greater Springfield CHNA to continue to engage in honest conversation to deal with the continual process of pursuing access to maintain relationships which ensure and assure educated, literate communities. All people thriving and flourishing free of violence, embracing health, the basis of life at every moment. Also, to continue the access to fresh food and health care as we engage the minds of our young by energizing activities that increase their wellness.
What I'm going to ask you to do now is nourish yourself, grab some food, and we'll take a break for a little while, then we'll come back and do the next piece. What I would ask, though, is you to take a minute to think about whatever the issue is. So again, we talked vision. The question I'm asking you now is, what resources do you need to accomplish your vision? So in thinking about the vision, I'm asking you to maybe focus on one particular emerging theme that's either up here or one that you have in your head. Okay? So we've got engagement, participation, communication, funding, DON process. Edna.
Health equity.
Please stand up. Health equity. Okay.
Hey, we got the team going now. I'm sorry I have to leave you too, but if you don't need all
Thank you so much.
If there's someone from each of the groups that could report out, again, remind us of what your topic area was, but then to give a little bit, like a 2 or 3 minute summary of what your group talked about. We will take all of these notes from today, type them up, and get them back to you, okay?
It's just something that has continued to resonate in me, conversation after conversation, is who are we talking about when we're talking about population health?
Anything else from this group?
Yeah, well said.
Ms. Francis?
Who are we talking about and what are we talking about?
Great. How about a round of applause? Thank you.
That is one of the main things that should be an objective, is that we work to change people's behavior so that any group presenting themselves at an institution can feel that they are going to get the same service, not based on any outside opinion or any kind of racist behavior or thought process that someone may have. But if I walk into a hospital, I want to know that I'm going to be treated the same thing, not having, many cases, for instance, as African American as an example, where African Americans were not offered certain cardiac procedures, and so they didn't get the same level of care as a Caucasian that walked in with the same symptoms, everything. So those that we felt that racism was sort of the foundation of a lot of problems in health equity issues, and this is an ongoing thing. We don't assume that it's going to be solved with one little training set, a workshop on racism. We don't anticipate that.
First, again, thank you all for your thoughtfulness in terms of this exercise and earlier. What I want to do is turn it over to Cathy to talk about next steps, and Eileen.
So I think it was a good day. I hope you all feel the same way.
I'd like to propose that as our first advocacy, we put together a white paper about why we think CHNAs are the way to go. And Fall River is willing to do some authorship on it and then send it out. We will use the notes from this meeting. We will send it out, and then if you and your CHNA would like to sign onto it, we think that would be a great first step. So thank you very much, and we look forward to our continued work.